date today is June 14th, 2006. With us we have Diane Sainer from Ohio. Diane is a 56-year-old woman who suffers from RSD, reflex sympathetic dystrophy, fibromyalgia, and some heart disease. Coronary artery disease, yeah. Diane is going to tell us a little bit about her RSD history. So Diane, why don't you tell us when you first experienced symptoms of RSD, whether it started with an injury or not, and when you were diagnosed with RSD.
Okay, when I was 10 years old, I fell and broke my tailbone on the ice. It was about 2 months after that I started having severe pain in my legs and burning. When we went to the doctor says it's growing pains. And to add insult to injury, I then burnt my foot when I was 16 with hot grease to the bone. The RSD symptoms continued. Nobody knew what was going on. It has impacted my whole life. When I went to Dr. Hushman, a renowned specialist in Florida, he diagnosed me with reflex sympathetic dystrophy in 2001 and determined that I had had it since I was 10 because I had a very profound history with profound symptoms. I have it total body and have had it total body probably since I was 16. And as the years went on, sometimes I would have a bit of a remission, which is not unusual when you have children. I had 3 children. But then as the years went on, the symptoms got worse and worse. It didn't help. I had a lot of car injuries, had a lot of car accidents I was in. I was also hurt many times in volleyball. And finally it got to the point that my foot was killing me. I couldn't even have a sock on it. I went to a podiatrist. He did unnecessary surgery, as we now know, which only furthered the RSD even more.
When was that you had the surgery?
In 1999, December of 1999. And it only made everything worse. And after I was diagnosed, I tried treatment up here. The standard, in Ohio, the standard treatment is monotherapy injections of either lumbar sympathetic blocks, which only made it worse. And then it started attacking my internal organs, my liver bile ducts, my heart. Didn't know what was going on. I was very ill. And when I called down to Dr. Hushman, described my symptoms, he said, "Can you get here in 2 weeks because you are in trouble?" And literally, Dr. Hushman and Hashmi saved my life. They really did. They got me off medication, on appropriate medication, and did multidisciplinary blocks, is how they handle it, treat it down there. However, as the years went on, the blocks were supposed to last like 4 months, were only lasting 3 months, 2 months, 3 weeks. Nothing was working. I do have an intrathecal pump which was put in 2002 upon his recommendation. It did help. If I did not have the pump, in all honesty, and I'm not exaggerating, I would not want to live because the pain was that severe. It does control most of the pain from my waist down. However, as the years continued, especially into 2005 and 2000s, through 2005, I continued to go downhill very quickly. From October to December, I was very, very sick. The cold weather makes it worse. January, February, and March. I could walk maybe 10 minutes. I was using an electric wheelchair in the stores. I could only go to stores that had electric wheelchairs. Unable to, I could wash maybe a few dishes and have to sit down. I did make an upswing in April when the weather started getting warmer, but I knew that I was almost without hope because I knew my body was going down. With the RSD, it was really taking me down because I do have it full body. And when I found out about this study for hyperbaric, it gave me hope. And I had heard about hyperbaric previously and done some studying. And when I was invited into this study, I was thrilled. And I will tell you now that after the first week, I seen results immediately. I cannot believe the difference in my life now. After the second week of hyperbaric, I had the opportunity to go and watch kayaking, and I was in very cold, wet weather, which normally, if I'm out a half an hour in that, then I will be curled up in a ball and in severe pain for 3 to 4 days. I was out probably from like 9 in the morning to about 1 in the afternoon. I did get very, very cold. I never suffered any pain whatsoever. No pain whatsoever, none. And even since